to the Cosmetic Podcast.
Cosmetic means being a person or thing that gets rise to a phenomenon that is dynamic or energizing.
We're tackling topics and telling the truth.
I'm Rodrigo Ross.
And I'm Feinthel.
So today we have another installment of our innovation series with YMCA. I'm loving these series. I really am. We've had some spectacular folks. And today is no different. Sorry, not sorry. We're talking to one of my most favoriteest people in the whole wide world and one of my new most favoriteest people in the whole wide world. Today is Health is the New Wealth, featuring Heather Wilson and Trish Feinthel. She fine, go tell that.
There you go.
Talking about health innovation and health is our wealth. Welcome to the Cosmetic Podcast, ladies.
Hello.
Thank you.
Yes.
So what's going on out here in this health space? We're talking about health is, I tell you what, if health is the new wealth, then last few weeks, the last couple of months, I've been doing all right, but
y'all, please don't get him to talk about this new yoga class he taking. When he first started taking this yoga class, I happened to go by his branch. He was looking a little tense. I said, what's wrong with you? You look locked up. I started taking yoga. I said, oh.
That downward dog, baby. That thing, boy. Woo. I got about probably 10 good seconds before I got to rest in that downward dog. You know,
come out there.
I can't, yeah. But what's going on out there in that space that folks need to be aware of?
I'm gonna defer to Trish because she's new to the show. Can we do that?
Thank you. Oh, thank you, Heather. And thank you so much for this chance to get on with you both. This is great on a Friday. It just feels really good to be with you. So thank you. So what's going on? I will say more than ever, we need to meet our members and their communities where they are at.
Yes.
Right. There is new behaviors that were picked up in COVID. New behaviors like they more than ever value outdoor cardio. They've learned how to do some wellness at home. They want to keep doing wellness at home, as well as the impact that we're experiencing with the importance of mental health and wellness, right? So Keith, you're saying yoga. Now we have members coming back that are learning that they need stress reduction, but were once cardio and strength advocates, right?
Yeah.
So meet your communities where they are at and give them every type of option that you have in a clear and consistent way. That's what I would say is where we are now.
Nice. I love it. And Heather, I know you have been an advocate for years, you know, really being that voice like, hey, y'all, we got to make sure we take care of everyone in the community. Let's not have this really closed in, right, concept of who the health and wellness consumer is. So talk to us about, you know, what are you doing in the space to make sure everyone has access to total health?
Yeah, I mean, Trish said it best, right? And that's exactly what I was going to say, meeting people where they are. I think one of the things that I've always been a proponent of is redefining what a health seeker really means.
Yeah.
I think we get into this space of, a health seeker is somebody that isn't familiar with a fitness facility or has started and stopped or any of that. I think during the pandemic, we saw a lot of people that kept our lights on, right? And a lot of us paid, whereas that young group, right? That more advanced exerciser, that we need to be catering to everybody and meeting people where they are and do what they need to do, being innovative. I think that's a big mistake if we don't do that, right? So for me, that's the one piece as we talk about what's in our health and wellness physical spaces, right? The second piece is what can we do externally, right? That more hybrid Y approach. Where you're actually going out into the community and doing things like Y on the fly, et cetera, but not just about the physical fitness and the physical well-being, but the mental, the other pieces of the social determinants of health that the Y can play a role in and has really through the pandemic. So again, what's in our spaces, what's out of our spaces, and how can health equity to me is and should be at the base of our healthy living strategy across the board. Whether it's fee-based programming, whether it's member value programming, or whether it's, a social need out there that we're trying to fill.
love
So
that.
that's my take on that.
Yeah,
Yeah.
I love
You know,
that.
there's so much them different things that are out there. You know, one of the experiences that I've seen recently is just an innovation in the wellness space is kind of this virtual setting. You know, we got Y, you know, in the pandemic, a lot of people set up things virtually. I was in a Y recently outside of Dallas, and they had the platform where folks can come in and ride their bike to a video.
They came into the Y and
Yeah.
watched the video.
Watch
the
it on
rest-
TV. So, you know, from a standpoint of having to pay an instructor, they didn't
Yeah.
have that cost right there, but they had the stream for
I need an
folks.
instructor because I need somebody to give me the eye because I'm gonna start riding that bike.
Yeah,
I'm
well,
probably gonna
that
be
is
cooking
that
to the
is
class
that
and-
is one deter from
Yeah.
the innovation side. You ain't got nobody like Rodrigo. Get to moving.
I hope the instructor doesn't sound like that.
Well, I'm gonna come teach one of the classes.
I'm not taking that class.
But you know, that's just one way using the technology in the innovation space. Another space that I've seen, I was talking to Ernest Lemieux up in where's Ernest at?
In Ridgewood.
In
New
Ridgewood.
Jersey. Yes. And
And-
you guys is neck of the woods.
Yeah, and then in San Diego has this also, but they have this box container that has equipment in there, and folks can just come in and out and check out the equipment to be able to exercise, you know, right there on the spot. So
That's
many
good.
different ways that Ys are getting into this innovation space of other than just coming in and getting on the treadmill or pushing some weight up from a bench or something like that. I don't know if you
Yeah.
guys have seen some other things or know the impacts of other different types of things in this health and wellness space.
Sure. And and Heather, real quick, now I remember where you and I connected, because when Heather and I were on a membership call together, we both bonded on the phrase "never waste a crisis." I remember now.
That's a
And we
good
talked-
phrase.
We
I'm gonna
talked
get a
about.
t-shirt.
So I know you and I have
Great.
both been with the Y for a really long time. I'm not going to say how long because then you'll do the math. But I talked about in COVID, it reinvigorated me to return to mission, and not so much being worried about the grind of the P&L and merger and where are you at, but it gave us a chance for the world to stop and just reconnect with how do we best serve. So to that, I'll just speak from an innovative space. So we, at the YMCA Bucks and Hunterdon counties, we lead Y Wellness 24/7. Look, there's multiple virtual platforms out there and they're all great. But in terms of with COVID, what I'm most proud about is it started just with us. And we got connected to over 43 Ys, and I'm talking like small, struggling Ys that said, look, I don't know anything about virtual. Can I join you? And that feeling of being able to say, come, join. And we have over 100 instructors now. Please, this is not a selling game. I'm not selling this. I am sharing the joy of like.
You should. It sounds
Sure.
awesome.
This is
Right?
what this is all
Yeah.
about.
I'm very, because there's a lot out there, right? But these Ys from Milwaukee to, again, Pennsylvania, New Jersey, Massachusetts, just saying we're with you. It's a collaborative schedule. And let me tell you, the statistics of virtual wellness, it's not a replacement for brick and mortar, but we have seniors with like pre-dementia stats with their health provider, what they were demonstrating, got on the platform in COVID and are no longer demonstrating those signs or symptoms of dementia because they got their blood flowing. Yeah. And the other thing I'll share is, look, as employers begin to have to come back to the workforce, you can't always get your sneakers on in the middle of the morning, packing the kids' lunches, getting them off to school, dropping them off, hoping you get into the studio. Now mom can be in the basement at 6 a.m. while they're still sleeping. She can do what she has to do, and she feels empowered and ready to start her day. That's and so for these Ys to see it and say we're with you is just, and it's a very economically sound. It's cheap. It's cheap, and I love that too, because we're able to do it in a way that fits the budget of these Ys. Because if you're not in the virtual game, you're off. Because
Preach.
Yeah.
Preach.
Yeah.
Preach.
It's no longer an
Preach.
option. Absolutely.
Preach.
There was
We
something
need
where we'll stand off.
Yeah.
We don't want to discourage people from coming into these Taj Mahal buildings we built. That's a whole different podcast.
Yeah.
But I absolutely, you should absolutely just do a PSA, Trish, because I am definitely the person that needs to go in the building because I need that level of accountability.
Yeah.
But the way you talk about it in the duh moment that I just had, like, girl, you don't have to get in your car and go all the way over here. You can do this, right? It's like, heck yeah, I should be doing virtual health and wellness.
It's options. Like, and so we got so many wives trying to stand up like our old model. And it's like, come on, man, figure out this. And in some ways, it's not really that costly to be able to do the virtual platform.
Right.
I mean, we're finding in our space with esports, like when we turned that on, and we still got it on today, we got young people playing these games all over the area, while we got wives talking to us about trying to build a $100,000 room out. Well, I'm gonna tell you, you're gonna get real limited right there. The virtual space that you talked about, man, just opens up so many different doors, and it's a different way to do business, and we got to be able to lean into that right there.
I love that. So Heather, you talked about social determinants of health, right? Talk to us more about how innovation really can position the YMCA to affect those social determinants, and what are some of them?
Yeah, I mean, for me, I think the Y as a community-based organization is both obligated and well-positioned to be in that space, which is all around health equity. But it's also the fact that we are not the healthcare provider. I do believe we can change the way healthcare is delivered in our communities if we partner with the right people to do that. And that involves, right, the Y staying in our lane and what we do well, but partnering with those who cannot reach necessarily the people that we can reach because we have that community, right? I think you saw that a lot with the vaccine work, people reaching out because they could not get people vaccinated, but the Y, if it was at the Y in spaces where people are in high volume, but also in the communities, there was more of a trust factor. So, I feel that we are, as a community-based organization, we are obligated to be in that space. And it's a crisis if we are not, especially through the pandemic and what we saw the Y having to kind of morph into, whether it was food distribution, whether it was starting food pantries, whether it was, we had partnered, when I was in Central Maryland, we had partnered with a healthcare entity that came in and brought their mobile unit to do well child visits for those who and for those who had lapsed immunizations for 2 years, and so it's, again, bringing it to the community and where the trust lies. Again, I'm very proud of the fact that in Baltimore City, when I was there, we brought the vaccine in partnership with CVS. We brought the vaccine to the Druid Hill community, which, the average life expectancy there is just under 57 years old, which is crazy. But we brought the vaccine there, and in 4 weeks, we vaccinated 1,500 people, just in that facility. And so there is something to be said about the Y, who I think still has some work to do in identifying who we actually are as an organization, because it's not consistent across the board. Right. But you asked about other social determinants of health. That could be, employment, that could be where you live, your zip code, your healthcare access, that could be, are you more prone to chronic disease? That could be your built environment. It goes on and on and on, but we are in spaces that touch many people. The other thing that I will say is, I just completed a zip code report for all of our branches. And I think that was eye-opening to some folks whenever you actually take true demographic data and then overlay it with what's actually going on and who you're serving, and see that in some cases, some branches are mirroring, the membership is mirroring the community, right? But then in other cases, there's lots of work to be done, and there's both a moral and a business case to serving underrepresented populations. And so, for innovation purposes, I think, again, I think I told you this the last time, I'm not a hockey fan, but I am a Pittsburgh fan, born and raised there. And so, Wayne Gretzky, he said something that was so profound, like, you don't in hockey, right? You don't skate to where the puck is, you skate to where it will be. And I think that the Y during the pandemic really did a lot of skating to where the puck is, just kind of like Peloton, right?
Yeah.
Peloton skated to where the puck is, but now they're in trouble because they didn't think about, exactly what Trish said, is people want to be in person, but they also want a virtual option. And so if you're not in the virtual space, and quite frankly, we should have been in the virtual space,
Absolutely.
but you have an antiquated thought process and lots of whys with lots of leaders that didn't allow for that. So we were really behind the 8 ball, and we're still behind the 8 ball. And some people pivoted quick, and some people are trying to revert back to that traditional come in brick and mortar. And membership really cannot be defined as somebody that just comes into your health and wellness facility. Like that cannot be, or we will not, we will not survive.
Yeah, Heather said a thing. She said a thing
both
today.
of you all have spent the last few moments talking about really things that we were not heavily involved in some less than 2 years ago. Right. And so now things are changing, and you guys are really speaking about the future of where that puck, like you just talked about the example of the puck, where we should be. And what do you guys see? What do you guys see right now that Wise should be doing like really different? Like, what is that absolute, like, hey, Wise, stop doing this, start doing this?
Yeah. You want me to go? So what Heather just said about we should have been doing it. So we're asking ourselves right now, like, what is the next Peloton? She's right. We were losing units to virtual before the pandemic hit, right?
Yeah.
So what is the next thing? And I'm telling you, because I'm seeing the same behaviors as esports. So we are about to build out, Keith, we're partnering with a company, and we're going to build out this esports studio. Can I tell you the amount of Wise I talk to that say those children should be in karate? Oh,
yes.
So maybe they're not a football star, but that's what karate's for. And I'm like, you know what? Or maybe that child should gravitate to what brings them joy, and let's get them out of their basements and into the Y, where they can meet other kids, they can socially connect. But what Heather's saying is that habit of like, well, that's not the Y. Well, says who? So we see esports as the next needs to be a menu of options for our youth. Get them out of the basements, get them talking. And then I love, well, are you going to do like physical exercise breaks? No,
it's esports. That's fine.
But are they going to learn how to collaborate and talk and cheer each other on? And mom doesn't have to worry about the stranger on the headset. Absolutely. So I would say, I think there's two. I pinpointed esports just because I wanted to be able to share when Heather said there's that old way of thinking. I think we're there. And then the other piece is just, we need to calm down with what's the next bell and whistle. I'm gonna, and I don't mean this with any offense for the Ys that are trying to debundle and make it a la carte. Like, that's great. Like, explore that, but let's get back to basics of valuing our staff, giving them tools and resources that they need, calm down, and get to just consistent practices. And that's something that was eye-opening to us in COVID. We were all over with merger. It's understandable. We're using this right now to master our craft. And so that's even innovative in itself, because who wants to spend time on SOPs? Nobody does, but our staff need them. So I would say that's the next innovative piece, is how do we become a consistent brand in the communities that we serve, especially when you're multi-branch, that wherever you go, and this is Neil Nickel, by the way, that a Coca-Cola tastes like a Coca-Cola tastes like a Coca-Cola. From a service standpoint, we're going to represent our communities with different programming, but you should always feel warm and kindness no matter where you go, and not just because that branch leader maybe delivers a different tone, if that makes sense. So that's like where we are right now.
I love that.
And Trish doesn't know this yet, but her and I are going to just leave town and start our own Y, because we're speaking.
Yes, we are.
I'm coming to get a membership, a virtual one, a real one. I'm getting a membership.
Can y'all come down south? Or look too cold up north for me.
You will not go up north because it's cold. Get you a good coat.
You know what,
YMCA.
I come to visit.
One of my, I started in Central New York in February. And one of the things, you're speaking the same language, Trish, because the foundation and the accountability have to be there if we're trying to move forward. The consistent representation of what the why is, no matter if you're in an urban, suburban, rural, down the street, 20 miles away, whatever it is, needs to be consistent, down from how you speak to people, to your name tag, to what is the best practice that we're doing. Whenever, I think I mentioned this on one of the calls to Suzanne that time, and it was all around my thoughts around those, how we combine those two focus points and thinking about our current business model, right? So we have the health and wellness, the traditional membership model that people really just continue to drive. And it's not that it's a bad model, it just needs to be enhanced, right? And how we start to think about what membership for all really means, right? And then how you combine that focus point with the social services piece, or just the other non-traditional revenue drivers like third party, right? Third party payers, et cetera, right? And then you need to think about, in terms of like the two focus points, how can they really work together, right? To sustain the current business model if you don't have a different philosophy, and how they support operations, right? And so you have all these wonderful ideas, right? And coming together, but the reality is that the basics and the foundation have to be there. The identity of the why needs to be defined and consistent across the country. It is not consistent. I mean, we are still trying to get into communities, right, across the country that don't even know what the why is or what the why has to offer, right? We're still going and spending so much time trying to build relationships with people that we've been for over 175 years. Like, you think people would know who the why is, right? And what the why does and how it benefits them and the community, but they don't. And I feel like that is because branches, centers, whatever you want to call it, people are all over the place. Like, they're just, you don't want to squash creativity, but at the same time, like, can we have some consistency of what we're doing? Right. And so there's a lot of people that are, I'm a firm believer that whatever model we use, right, it has to make money, right? No margin, no mission. That's how it goes, right? I get that. And there has to be some revenue generating whatever you decide to do. But there also has to be very strategic, forward thinking, and intentional about the why. Cannot be everything to all people, but we can partner and collaborate with people. And I think the why also uses the word partnership very loosely, because not everything is a partner. Right? Not everybody is a partner. Sometimes it's just a relationship, right? Sometimes it's just a relationship, and sometimes it's we need to start getting back to, how is this going to benefit the why and the community and the people that we're serving, and not this other entity that just wants to put flyers up in your building or have you promote something, et cetera. The other thing that I would say is, I totally agree with Trish on how we engage our youth, right? From that 7 to 8, 9, 10-year-old group, right? But those who aren't necessarily in organized sport, right? Because that's a whole different discussion, right? So how can we start really engaging them early? Because before 12, right, is the time where they're going to determine if they want to be physically active or not, really, if they're not an organized sport. And so I don't think, I'm preaching to the choir here, but the why does not really engage that group like they should. So there's that piece of it. There's the virtual piece of it. And then there's the health innovation piece of it, which is bringing in third-party payers and figuring out there's money out there. Trust me, right? They just went through a whole heck of a lot through the pandemic, and they saw a lot of money lost, right? And written off. And we need to be in the health promotion, prevention space. We can be in lots of spaces, but we need to be in the health promotion, prevention space. And that's where the hospital systems and the healthcare entities cannot do that. They can't do what we can do, and we don't leverage that because people are afraid and are risk averse. And so that's a problem, right? There's lots of ways that we can generate different revenue sources and different revenue streams to make our Y very healthy. That's not just related and relying on the traditional membership model. Okay, the last thing I'll say, and then I'm going to be quiet, is looking at your spaces, right? So if whether you have 2 spaces, 1 space, 6 branches, or 15 branches, you need to do a deep dive into like, what is this branch actually like doing? Is it serving the people the way it needs to be served? Are you going to continue to drive home that we need to have membership and fitness in this facility? Or are you going to go out in the community and ask the people what it is that they need? Are you going to partner with health departments and healthcare entities and be a part that the Y at the table for community health needs assessments? This is now the second one that I only been there for 15 minutes. And I'm like, oh, no, I need to be on this county one and representing the Y so that we can then take what we can be there to say, okay, this is what this county needs. This is what we can do. And now let's come into it with a plan to attack it from both angles. And we just don't do that. We just like sit back and it's like, oh yeah, did you read the health community health? Was the Y at the table? Like, are you in the spaces? Are you in the rooms to be able to actually be innovative and we think about healthcare? Okay, now I'm going to be quiet.
You have said something today. So this is fascinating for me. So what you guys are really elevating in this innovation space in health and wellness is that sometimes the innovation comes in changing one word, changing the or. We don't have to do this or do this until our and, right? Moving, like Keith says, from that transactional to that transformational mindset, and to really getting back to some of our basics, some of the things that people will probably believe are not right so innovative, are fairly mundane, but creating that solid foundation that we can still move and create and be responsive and nimble and center the needs of our communities. Like, unfortunately, because we've been all over the place for so long, the pandemic made us realize that the innovation in this space was getting back, right? To the basics, listening to people, being there for your community, being the gatekeeper, so to speak, advocating for them, and being of the community, not just in a community. I love it. I love it. You guys, I'm gonna go to class today.
Trish, close us out. Give us a good word.
You're not gonna say nothing about me exercising today?
Give us the docs out.
Don't try to
we done had the sermon by
Pastor Wilson.
Pastor Wilson. Well, Miss Feinthel, give us close us out, Miss Feinthel.
All right, so here's my closeout, and I will say I've been with the Y since 1997, full time.
Wow.
But when I was onboarded, I think it was Alice Sawyer. The phrase was, "If you do not feed your staff, they will eat the members." So right now, as I'm on this with all of you,
yes,
most important. If I go, the members don't miss a beat. They really don't, right?
Yeah.
But we have to treat our people now more than ever before with what they need to be successful, because our members are messy, right?
Yeah.
So they rely on us to be the consistency and the clarity that they need. And our staff can't do that if we're not feeding them. So that's where I will leave us with. It's just feed those that are not in that room with you.
We need t-shirts.
Amen.
That's a t-shirt, right?
And this was awesome.
Pastor Wilson.
Pastor Wilson, associate pastor.
Miss Feinthel. Hey, cosmetics family, you have heard the word. Now it's your turn to go and do.
Yes, indeed.
Thank you guys for listening to Cosmetic.
On this latest episode of the YUSA Innovation Series featuring none other than Trish Feinthel and Heather Wilson. Health is the new wealth. Y'all better press rewind and listen to it again. I'm telling you.
Hey, love to subscribe and listen to us weekly.
And don't be shy. Give us, give them 5-star reviews all across.
And as always,
be dynamic.
be phenomenal.
Be cosmetic.